Welcome back. Well, a cancer diagnosis is always tough to hear, but a new immuno-oncology treatment option is now available for some with hard-to-treat cancers, like head and neck cancer. This year alone, more than 64,000 new cases of head and neck cancer will be diagnosed here in the U.S. So joining us to talk more about this treatment is Dr. Michael Gibson, along with Carly O'Brien with CancerCare. Welcome to you both.
Thank you for having us.
Thank you.
Thanks for being here. You know, I don't think we talk a lot about neck and head cancers. What exactly is it, and what are some things that we need to know about it?
You're correct, we don't. Because I think that it is a bit of a misunderstood and underrepresented or under-discussed cancer, but as you pointed out, it's pretty frequent at 63,000 cases a year. In fact, 13,000 people will die of this disease per year. I think it's difficult to grasp because we use an umbrella description of head and neck cancer, but it actually represents many cancers of subsites of the head and neck. For example, laryngeal cancer would be voice box cancer. You can have tonsillar cancer, you can have tongue cancer. So every sort of sub area within the head and neck region can get a cancer, and we lump them all together and call them head and neck cancer.
What are some of the symptoms? Because I would think, you know, so many of us feel things like headaches or sore throats or problems that, you know, oftentimes we worry, is there something more going on? What do we really need to pay attention to?
Yeah, I agree. My disclaimer, of course, is that most of these things I'll describe are not due to cancer, but they are worth looking into, especially if they persist. So, for example, a voice box cancer will cause a hoarse voice. A cancer of the tonsil or the back of the throat may interfere with swallowing. Cancer of the tongue, you can actually see growth there, which can be painful, it can bleed. So I like to say that anything that isn't right, that persists, needs to be evaluated. But I don't want to be alarmist, because oftentimes these are caused by non-malignant things.
Yeah, I think it's hard not to be a hypochondriac when we start talking about symptoms, you know, that can signify cancer. But as you mentioned, it's always good to talk to a professional if something is persistent. So let's talk about treatment. Say there's something that's been persisting. You go in, you have the tests, you find out, yes, you do have cancer. What kind of treatments are available, especially for head and neck cancers?
Yeah, certainly. Fortunately, there are a lot of treatments, and they continue to evolve and improve. The interesting thing about head and neck cancer is treating it is usually either a combination or a sequence of multiple different what we call modalities. So, for example, surgery, you could remove the cancer. Radiation, you could shrink it with radiation. You could use chemotherapy to control it as well. So a big team effort is required to come up with an appropriate treatment plan for every individual patient. Once that is initiated, the patients often require some help from our supportive care colleagues, so I'm glad that she's here with me today as well. Some hope for the future. There are many, many treatments in development in clinical trials, meaning some of them will ultimately become approved for treatment of head and neck cancer. We have immunotherapy, which is the most exciting new treatment, a drug called nivolumab or Opdivo, that acts by fooling the patient's own immune system to recognizing the cancer as foreign and attacking it. So this is one of the new waves. There are many such drugs available, and a couple of them have been recently approved by the FDA.
For you, Carly, now you are the Caregiver Program Coordinator at CancerCare. I think someone, when they get that diagnosis, needs a lot of support, whether it's friends and family or outwardly a group that knows a little bit more about what they're going through. What kind of support do you guys provide?
So luckily, there's a lot of support available to patients and their caregivers. We know it's a different experience being a patient, and it's a very different experience being on the caregiver side. So CancerCare is a national nonprofit organization that provides free professional supportive services. So we're a staff of licensed master's level oncology social workers, and we provide individual counseling and support groups in person, over the phone, and online. Again, both for patients and their caregivers, because we recognize that the experience is different, and we want to make sure that everyone who's affected by this disease in any way has support. There are a lot of other organizations out there too that provide other supportive services like peer connections and just the ability to connect with somebody else in a similar situation. So organizations like Support for People with Oral and Head and Neck Cancer, or SPOHNC.org, the Oral Cancer Foundation, the Head and Neck Cancer Alliance. These are just a few of the disease-specific resources that are available to patients and their families.
We ran out of time, but I know in terms of asking doctors a question, or how family and caregivers can help those who are struggling with their cancer diagnosis, can people find more at your website with CancerCare?
Absolutely. We have a lot of information about communicating with medical providers and specific resources for caregivers. So visit cancercare.org or call 1-800-813-4673 for more information.
Wonderful. Thank you both for joining us, Dr. and Carly. We really appreciate it.
Thanks for the opportunity.
Thank you.
Absolutely.